Hello, this is Cheryl Yvette for discussion 3, lessons 5 and 6. So the structures at my practicing site to encourage and support the use of evidence-based practice is multi-level. So when a nurse comes in as a brand new nurse, never having worked anywhere else, they will be in a 1-year program, whether nurse residency or transition to practice. And in those 1-year residency or transition to practice, they will start a evidence-based project. If they're an ADN, they'll do a QA project as a group. And then if they're BSN or MSN as a new nurse, they will do a research project. If they are a new nurse to the facility, but they've worked as a nurse elsewhere, they will go through new nursing orientation, and they will be introduced to the support structure and explain, our philosophy. There's a phase 1 and a phase 2, and in the phase 2, they actually get more training. There's learning modules and everything for them to do. Our EBP is run through our education department, which has multiple people, but some of them would be like we have 3 nurse scientists at our hospital. We also have 1 nurse who's dedicated to making sure or overseeing the SOPs. She doesn't do it herself, but she's the person who's in charge of it, the nurse leader for that. And then our hospital is actually right now going through American Nurses Association, I believe it is, Pathways to Excellence, and then eventually Magnet. And in doing that, that looks at, what your evidence-based practice is and what your shared governance. And that's how we go through, making sure involving all of our nurses is through our shared governance. And in our shared governance at the housewide level, there is actually a council that is specifically dedicated to evidence-based practice, QI, and research. And that council is fed with nurses from all of the units in the hospital, whether they're inpatient or outpatient, at all levels, registered nurses, nurse practitioners, and those who work in specialty clinics like the quality and safety management. And also, when we talk about the shared governance, just point out that our shared governance is in itself, even though it's nursing shared governance, it's in itself an interdisciplinary approach. Then all of our hospital is in a network, and all of those hospitals in our network connect with each other. And the national level, there's the Evidence-Based Practice Field Advisory Committee, and it's comprised of all the healthcare administration nurses and other healthcare professionals from all over the country. And these members help facilitate the implementation of evidence-based practice across the networks. And they work at the nursing level at the Office of Nursing Services, where they have websites, they have classes, they have mentors that are all there to help us. And the reason I bring that up is in doing our gap analysis, we did recognize that part of our weakness is, even though we have the structure and everything there, it's not really being used to its fullest potential. As I mentioned before, we have nurse scientists, and one of the nurse scientists last year went through to evaluate our program and found that even though all of the nurses feel that they do evidence-based practice, they feel like they don't really know all of the structure, what to do to make sure that they are doing that. So the confidence level was low, even though the use of it was considered high through this survey. So one of the things that they recognize is in doing our gap analysis, that even though, through shared governance, we have this really strong structure, we have this great education department, we have these wonderful nurse scientists, even one of them is on our IRB this year, which is not a common thing, we still have a communication gap. So before COVID, we had shared governance, we had a lot of participation, but it wasn't 100% participation. And then with COVID, a lot of the units that had, you know, shortages on overwork because of the number of volume, they couldn't run their shared governance meetings and cancel their shared governance. Some of them have come back up with shared governance, but not all of them have. So the role of the nurse leader in EBP is at our practicum insight is shared governance is the leaders communicating the structure and the value that the nurses have in using and contributing to the structure. Birkin and Associates in 2018 found that middle managers have the role of promoting and implementing EBP. And the studies over the past 20 years show that it's these middle managers have increased the use of EBP. And there are, even though we're talking about nursing shared governance, and that's how my practicum site uses it, when looking up for the other professionals like doctors and dentists and physical therapists, those practitioners have a corollary of evidence-based medicine, which looks at the conscientious, explicit, judicious, and reasonable use of current best evidence in making decisions about the care of the patients. So it's really important that we're interdisciplinary, so we're not stepping on each other's. So at my practice site, we have found for quality initiatives, we are meeting almost all of the benchmarks, but we have found in the past year, in the past 6 months, that we are getting close to not meeting some of them benchmarks. Some things that we've been perfect on, we've got 1 or 2 incidents now. And so we have to go back and look at what's the change in the population. How has that population changed since COVID? The mental health issues have gone up. And then just the population is getting older. So what is the evidence-based practice for our new population or more of a particular population? Thank you.